We're back. Sorry, last Friday I did that Facebook Live at Roof Sit. So we're here today in the spa right before the big 4th of July. I do want to point out this is our last Facebook Live for a couple weeks. I will not be in the office, so unfortunately we're going to be on the little download. Our Facebook page will actually be a little quiet for a couple weeks. So today is June 30th, 2017. So this will be our last Facebook Live for at least 2 weeks. Okay, just to let you know. I know we have a big holiday coming up. So we are going to talk about the perfect touch-up for the summer. So a lot of things, we see at the medical spa and the plastic surgery, the cosmetic surgery and reconstructive surgery is that, summer, everybody wants to be out. They don't want to have any type of downtime, but they want to look that refreshed look. So we're going to give that to you with BOTOX Cosmetic. One thing I love about BOTOX is there is no downtime to it, and it gives you that kind of like refreshed look that you're looking for with zero downtime and perfect for the summer. I'm really excited because Jenny is here today, and I know a lot of you see Jenny and she's fantastic, and it's really rare that she's here on a Friday. So hi Kat, I see Kat joined. I'm really excited for you to actually see her on Facebook Live because I know a lot of you actually have her as a provider. So she's fabulous. And we have Cindy here. She's going to be our demonstration. She was actually on our Visia if you go back a couple of videos. And one of the things we talked about was these wrinkles she had. So now we're going to show her how you can get rid of those wrinkles. As well as we're going to talk about what's BOTOX, what's the difference in fillers, units, all of that. So Jenny's here to answer all those questions for you guys. And so here we go with BOTOX and that perfect summer refresher. Hi.
Hi.
How's it going?
Good.
Good.
Yeah.
So I was perking you up. So Jenny is our nurse practitioner here at the Center Yourself Medical Spa. She does almost all our BOTOX patients. I would say most of them.
A lot of people.
So you see a lot of different patients. So I said they're really excited to see you on Facebook Live because I usually try to get Jenny on camera is like big.
I try to run away.
I know you do. She wouldn't even do Snapchat.
I got cornered for this.
I cornered her. I'm bad influence.
Oh, yes.
So what are we doing, Jenny?
We are going to do BOTOX today. Cindy's only had it done one time before, and basically I'll kind of talk about what BOTOX is. BOTOX is basically a purified form of botulinum toxin. So it's injected directly into muscles, which I can kind of point out. And what it does is it relaxes the muscle. So the muscle then just kind of is able to lay smooth and flat. And when your muscles aren't working to constantly pinch up the skin and make the lines basically on the face, then your skin has time to kind of heal and the lines just smooth out over time. So it's very precise. You can see, I'll have you make a few faces, and if you try to frown, like try to look angry, no, it's hard to do. So you've got a long muscle that goes down here called your procerus. You can kind of see she's got these little bulges here. Those are called your corrugators. And that, when you inject BOTOX into those areas, it's going to relax those muscles and help the 11 lines between the eyebrows. And it can even help with this little horizontal line that patients tend to get as well.
They call that the bunny line sometimes.
Yep, and on the side of the nose, sometimes people get little lines. Cindy really doesn't have much there, but that's another little spot we can inject. Then when you raise your eyebrows, you have two big strips of muscle called your frontalis muscle, and those basically lift everything up and create the horizontal lines across the top of the forehead. So that is actually not FDA approved to treat with BOTOX, but it's treated off-label pretty much by any place you're gonna go, whether it's a dermatology office or a medical spa. The only places that are currently FDA approved are around the crow's feet, and that muscle is a circular muscle around the eye called the orbicularis oculi, and that crunches everything up. So when you're squinting or laughing or smiling, that little round muscle around the eye contracts and creates the crow's feet lines right here. So that's the third most common area.
And you have to sometimes be careful in this area because, like, I can see right here with Cindy, she's got quite a good little vein here.
Yep, it you can kind of see, especially around the crow's feet area, is where it actually helps a little because a lot of times you can actually see where the veins are, so you can try to avoid it. And that kind of lends itself to talking about how bruising is sometimes a side effect of BOTOX. It's not very common. We actually have arnica gel, which we can use, which kind of helps stop the bruising process. And then there are things you can do beforehand to avoid or help prevent bruising. That would include avoiding things like well, not any prescribed blood thinners by your doctor, but over the counter like ibuprofen, Aleve, products like that. Fish oil pills actually thin the blood a little bit and can cause a little bit of increased chance of bruising. And then strenuous exercise right beforehand, your blood's pumping, so that also, she says, no, I didn't do that. So that also can increase your chance of bruising a little bit.
So do you work out?
And alcohol as well.
Never.
So yes, we do ask that you avoid alcohol for at least 24 hours before. Again, just to decrease that chance of bruising. If you did happen to have some, it's not a huge deal. We're not going to send you out the door, but we will kind of monitor. And if it looks like there are some areas where you might potentially bruise, then we will usually go ahead and put the arnica on you before you leave.
Perfect.
Yeah, so
right.
Those are the basics.
So I'm excited to see this. I know I've seen this procedure a couple times. So Jenny actually did this on at our spring fling live on stage.
Yes,
So she did a couple people. So she's really awesome at it. This is her niche. She also does most of our CO2s as well.
Yeah.
So sometimes if you need a CO2, you might have Miss Jenny.
Yes, that's true. This is just alcohol. So I'm just going to prep the skin and kind of clean off the areas that we're going to treat. If you have makeup on when you come in, it's not a big deal, but just so you know, we probably will be wiping it off with alcohol.
Now let's talk about one of the big questions I get a lot on Facebook is what's the difference between units and areas?
So areas are kind of what we just talked about. Like, so for example, the 11s area, which is targeting those 3 muscles I talked about, it's kind of considered an area. Upper forehead is considered an area typically, and then around the crow's feet is considered an area.
So when patients say, I want to come in for Botox, how many units do I need? I know we do it based on units, $13 per unit.
Correct.
So what is a normal average of units?
Normal amount to treat all 3 areas is going to be between 40 and 50 units. If you're not doing the crow's feet, sometimes you can get away with more like 30. So, but typically 30 to 50 is what most patients are going to get when they come in.
So you guys do the math, because I'm definitely not math. Oh, Cindy's the accountant here.
How long does it last?
Most patients, it's going to last about 3 months. So that's how long it works in the muscle, and then it kind of starts to break down after that. And you'll know when it's wearing off just because you're going to be able to move your face again in the way that you were before.
Now, another question I always get, and you can start injecting, Jenny, is that they've had
1, 2, 3.
Botox, but then they say they like come back 3 days, 4 days later, and they're like, "Oh, I'm still
frown
moving."
for me, and then relax. Yes. So basically, it takes about 7 to 10 days for the Botox to start actively working in the muscle. So that means that you're not going to notice results immediately because it actually does take some time to start working.
And you can see here she's doing those 11s.
I'm going to have you raise your brows. So you can see Cindy kind of has more of a petite forehead. You can relax. So she's just not going to require as much across the top here as some patients might. So yeah, the Botox is coated in a protein. So it's kind of like a M&M. The protein is what takes your body about 7 to 10 days to break down. So that's why. Now I'm doing a little bit on the lateral aspect of the brow.
And why are you doing that?
That provides a very subtle little eyebrow lift. So it kind of opens that eye area up a little bit.
Which is perfect for summer and gives you that little lift you're looking for and touch up. Now, as you can see, she is bleeding a little bit. That's completely normal. When Jenny's done, she'll wipe her down a little bit and that bleeding will stop. And again, this is no downtime. So patients can walk out and it looks like you have nothing done.
And are you doing okay, Cindy? It's really, it feels like little bee stings. Nothing crazy. And just kind of, and you can see it basically, it leaves these little bumps on the skin. A lot of times I've had, if you look in the mirror before you know that's going to happen, it's kind of like, what happened? But all that is the saline and the Botox. So just the Botox sitting right there in those precise places that we placed it. That will be gone within about 20 minutes. It just kind of flattens out.
Awesome. Now, she shouldn't rub, right? Is that correct?
Right. So afterwards, you want to try to sit upright for a couple hours. You don't want to rub the area aggressively. You can cleanse your skin tonight just with I would just use your hands. You don't want to like use a Clarisonic or a washcloth and scrub. Okay. Just kind of just really gently cleanse, and then you can go about the rest of your normal stuff. Avoiding exercise in the first 24 hours can also help, again, just kind of decrease those chances of bruising, but that's kind of more important to avoid beforehand than after.
So super easy. Look, this literally this takes us like 15 minutes at most.
That's it.
You're done. That was so easy, and now those wrinkles, they're gonna stop that movement to the muscle. So now those etched in lines are gonna hopefully eventually go away, as well as perfect for like a summer little touch up. And she got that little extra little brow lift, so that's kind of cool. So that's gonna give her a little more height.
Bit. Yep.
And it all looks natural.
Completely natural. People are always afraid of looking.
Like Tim Allen in like I always say the Christmas with the Cranks, because he gets Botox done. He gets Botox done, and then he like can't eat and like can't move his like muscles, and I'm like, that's just not realistic.
Right, yeah. No, done well, no one should notice that you look any bit like not like yourself.
Just probably refreshed.
Right, yeah. Yeah, no one should notice in a bad way. But people might notice that your skin looks really smooth.
Do I have to avoid the sun or anything?
No.
Any restrictions?
Well, you always should avoid the sun.
I always have my sunscreen.
Let's keep your SPF on. But
SPF on.
not related to the Botox.
Okay.
So.
She's a nurse practitioner, guys.
Yeah.
She does a lot of derm work for us, so.
SPF 30, guys, at least.
At least. My last question was, Jenny, really quickly, do you know how many units you approximately did?
We did 42 units.
Wow.
Yep.
Isn't that amazing?
It was painless.
Yep. Good. Awesome. You
so
did great.
At $13 a unit, Cindy just got 42 units, and she got all 3 areas, which would be here, and her crow's feet.
Yep.
And that was so quick and easy, and Jenny, that's why she's the best.
Aww,
well, we have other
nice.
injectors, but Jenny tends to, she's the best, she does probably them the quickest and does the most, so.
Aw, well, thank you.
Yep, so if you want a consultation with Jenny, let her know. She's happy to see you. Thank you, Cindy, for always being our guinea pig.
It was my pleasure.
She wants to look nice. So let's do one more look at it, you guys. You can see here.
You can see they're already,
yeah.
Those are almost flattened out.
Those are almost gone.
Yep.
And again, so quick, easy. Anything else you want to say, Jenny?
I don't think so. Have a happy 4th of July, everybody.
Yeah, I like it. All right, you guys, so just a quick wrap. I'm going to turn the camera here. Quick wrap up. We did Botox today. Perfect little summer refresh. It's $13 a unit. Again, you can range anywhere from 30 to 50 units depending on how much movement you have or how much correction needs to be done. Again, 15 minutes in and out, super quick, lunchtime special right there, and perfect for the summer refresher. Again, Jenny does the, Botox, Julie does it, she's one of our nurses, Soshi, one of our nurses, Kelly can do it, a nurse practitioner, Dr. Downs, and Dr. Viscardi. So we have a lot of people that they can do Botox here at the Centerpiece and Send Yourself Medical Spa. Also, again, I want to reiterate, today is June 30th, 2017. We're going to be off Facebook Live for 2 weeks. 2 weeks. So just keep that in mind. We'll be back again in middle of July with some awesome procedures. I have some really good ones coming up, so you'll be excited for that. As well as we do have a couple specials on our page, so check them out on our Facebook if you're interested in those specials. And that's it for us. We hope a good weekend. Dr. Downs wanted me to remind you, be careful of fireworks. He doesn't want to see you guys in your office. So have a great 4th of July. Bye, guys.